We are so excited to have some incredible Mercy volunteers here with us today to talk about their experience in healthcare placements. They're also incredible and doing great work during a pandemic. So I'm excited for all of you to hear their stories and what they're up to. So volunteers, if you could introduce yourselves, tell us who you are, where you're from, where you went to school, and where you're serving now. So Mary, if you want to get us started.
Yeah, my name's Mary. I'm from St. Paul, Minnesota, and I went to school at the College of St. Benedict in central Minnesota, and I majored in integrative health science and pre-med, and now I am working in Savannah at St. Joseph Candler Emergency Department. My job is a health coach, so I help patients that come into the emergency room that don't have insurance or that have Medicaid, and help to get them set up with primary care providers so that they're only using the emergency department when it's a true emergency. And also just help connect them with resources in the area. So it's a lot of social work stuff. So connecting them to food resources or affordable housing or counseling that fits within their budget and things like that.
Thanks, Mary. Claire?
Hi, everyone. My name is Claire Feller. I'm originally from Louisville, Kentucky, and I graduated from the University of Dayton this past May with a degree in biology and minor in psychology. And right now I'm serving at Cabrini Clinic in Detroit. We are the oldest free clinic in America, so we serve the uninsured and underinsured population of Metro Detroit, mostly focusing on primary care with mental health services as well.
Thanks, Claire. And Emily?
Hi, so I'm Emily. I'm originally from the Twin Cities, so just south of where Mary's from. I graduated from Viterbo University last May with my major was nursing and minors in psychology and family studies. And currently I'm in Baltimore working as a nurse on the mother baby unit here at the Mercy Medical Center, not to be confused with Mercy Volunteer Corps. It gets confused all the time in my brain. But yeah, I'm a nurse for the mother baby unit. It's the hospital that has the most births here in Baltimore. So we see lots of humans all the time and it's really fun.
Yeah, thank you. And I forgot to say at the beginning, if you all have any questions, please feel free to send us those in the chat and we will answer those throughout the night as well. So you all told us what your role is. Can you tell us what day-to-day looks like? What kind of things are you doing in your role? And Claire, if you want to start this time?
Sure. So every day looks a little bit different at the clinic. So we have a medical clinic on Tuesdays and Thursdays, and then we have a mental health clinic on Wednesdays. So that keeps every day looking a little bit different, but a lot of my role involves coordinating the front desk, so taking phone calls, and I never know who's gonna give me a call. So kind of like Mary said, it's a lot of social work, trying to figure out various clients' needs and trying to connect them with resources, even if it's maybe not at our clinic specifically, making sure that we point them in the right direction to find resources. So a lot of managing kind of the front desk, clerical, electronic medical record, as well as my favorite part is interacting with patients. And I've started to have a little bit more of a chance to do vitals and take patient history, which is something I'm really excited about.
Yeah, thanks, Claire. Emily?
Yeah, so I am a nurse in the mother baby unit, which is exactly what it sounds like. I work 12 hours a day, 3 days a week. Which is really, really fun to just be able to be with patients for their entire day, see them from start to finish. So I'm currently precepting still. So I have a wonderful preceptor and I love it. And there we basically, right after patients give birth,
You're good.
Okay. Okay, cool. Right after patients give birth and they're done on labor and delivery, they come down to us. So we help patients get in a swing of what it's like having a brand new baby. What do they need to do? What do they need to look for to keep themselves and their babies healthy? It's a really fun time. We get to work really closely with social work and CPS and a lot of dietary needs and a lot of people that come together to really make sure that these moms and babies are ready to go home and live and grow and do good things in the world.
Thanks, Emily. Mary?
Yeah, so part of kind of a day-to-day, like we go in the morning and then we print out a list of all the patients that are in the emergency room that don't have Medicaid or that don't have insurance or have Medicaid. And it's kind of nice. We get to see our own patients. So we go into the room and just kind of talk with them, like have a conversation about if they've had a primary care provider before, and if not, you know, like we have a couple clinics in the area that accept patients that don't have insurance. Kind of like Claire's clinic, they operate similarly. So that's really nice. We get to connect them with that. We help them make appointments. We kind of educate them on the correct time to use the emergency department. And like I said earlier, we help them to get connected with other resources that they might need. So if they need a place to stay, we help them with shelters. If they need food, we get them the food pantry information, things like that, help get them signed up for food stamps or such. And then part of this role too is also working with the Georgia Southern students. So part of, they can take a class at Georgia Southern where they pretty much do our job, but for like an internship credit for a class. So we're actually doing training for them next week. So that will be kind of exciting to get a fresh batch of students in. And yeah, we pretty much see patients all day and work with students.
Very cool. What has been each of like, I'd love to hear like the rewarding parts of the work that you're doing. Healthcare can be such a busy, taxing field to be in. So I would love to hear maybe a story or something reoccurring that's been rewarding for you. Emily?
Yeah, so I feel like a lot of the times my job gets really task orientated, and I think that's just how my brain works. But it's really fun and special when the moms feel comfortable enough to tell us their story and to tell us like why they need the extra resources and to tell us like, oh, I was just on the phone with social worker because of ABCD, and these are the resources that they're helping me to get. And it really helps me to be able to see like one, them as a person and be able to help them holistically, not just your medical needs. I'm able to help them like with everything else that's going on with their lives as best as I can. But also it's really cool just to be able to like see them as a person, and they're just excited to tell me and tell a brand new person like, oh, like this is my fourth baby, or this is so much fun. This is our first blank, go boy, girl, whatever. And it's just so much fun when they are just so excited. Being in like mother baby is one of like the few places in the hospital that patients are really excited to be in because they're not hurt, they're not injured. We get to help them with this really big milestone of like bringing home a new person. And so it's like really fun and beautiful to just be able to like be there with them with this like really beautiful little milestone in their family's lives.
Awesome. Mary?
Yeah, kind of like bouncing off of Emily too. I think that was like really awesome how you talked about like getting to see the patients as people and not just like another task that you complete off your list. Because especially like as science majors, I feel like that's very classic for us. But it's so nice to get to like hear their story, and when they feel comfortable enough to like talk to you, especially we had a retreat earlier this year about hospitality and about how one of the quotes we talked about was just being able to like take the weight off of their shoulders for a little bit, because for a lot of the patients that I'm working with and that I'm sure that Claire and Emily are working with too, like they don't have that hospitality in other areas of their life. So it's nice for them just to know that like here they have a safe place, like they can talk about what's going on. They don't need to feel like they're going to be judged or anything like that. And just to know that they're going to be cared about. So I think that's been really rewarding. It's just to be able to be hospitable to these people where they don't really necessarily have hospitable lives. So.
Claire?
Yeah, I think going off of what Emily and Mary both kind of talked about, I think one of the most rewarding parts is really just getting to know our patients and getting to know their stories. We have a lot of like regular patients that come in pretty frequently, so it's nice to get to know their faces and just kind of get to be a part of their story. And then another rewarding thing that I've recently started doing is I was trained to help people sign up for Medicaid. And so obviously we can provide quite a few resources at our clinic, but we can't provide everything. So just getting to help people through that process and sharing the good news is really rewarding. And knowing that that will help them in the future have more of their healthcare needs met.
Yeah, thanks. How did each of you come to Mercy Volunteer Corps? What were some of your goals, and why did Mercy Volunteer Corps speak to you for the right next step in your life? Mary, if you want to start us off.
Yeah, I think I've known for a long time that I wanted to go to medical school, and I think after high school, I think I went into college a little bit burnt out. And so then by the time I had finished all my pre-med recs, I was like, I cannot go straight into med school. I will crash and burn. So I was looking for some different gap year opportunities, and I just feel like I didn't have enough time to like really devote myself to volunteering in college because there was so much other stuff to do. So I was really excited about a volunteer year opportunity, and I was kind of looking into JVC, Jesuit Volunteer Corps, too, and some other different volunteer corps, but Mercy really stood out just because of the way that they are very like personalized with how they reach out to you and continually reach out to you. Marie, who's one of the volunteer coordinators, is amazing, and she like remembered everything about my family and about what was going on in my life when she would call and check in on me, and would like recommend different opportunities. And when she had called about this one, it actually was great because I just think that this specific position is super unique. It's one of the only medical home programs in the country. So it's a really unique opportunity to get to work with patients in this way. And I think it will make me a better doctor too, in the fact that I will have a way better understanding of like the actual barriers that my patients are facing instead of just automatically assuming that they aren't being compliant. So I think this position too really drew me to the volunteer corps, but I think overall it has been, I'm really glad that I chose this one because continually throughout the year, Mercy Volunteer has done an amazing job of making sure that we are cared for and that we have a community and that we never feel alone. And I think that that's very unique. So.
Thanks, Mary. Claire?
My path is really similar to Mary's. I have also known for a long time that I eventually wanted to go to med school, but kind of going into like my junior year of college, started to feel really burned out and knew that I was going to need a break before doing a whole nother 4 years of school. So I kind of looked at various opportunities to spend the year before going to medical school, thought about maybe working or doing research, but I always just kind of had the idea of doing some kind of volunteer service on my heart. Like Mary said, college was busy and I tried to do as much volunteering as I could, but it's hard to find a lot of time to devote to that. And so I found out about MVC, and I knew about a few various other volunteer programs, but I kind of just kept going back to MVC. I felt that everything was very personal. I worked with Marie as well, and I felt like she really wanted to put in the effort to get to know me and help me with my journey. And obviously the healthcare placements offered through MVC really appealed to me because that's something very unique that you don't find in a lot of other volunteer programs.
Thanks, Claire. Emily?
So I have a little different story because I'm not going to med school. Bummer. But I also knew kind of coming out of school that I wanted to be able to do some more volunteering. I'd gotten to do a good amount throughout college, just here and there, but a lot of them were just like shorter amounts, like a week at a time or like a week and a half. And it was like very much more immersive. And I really liked that concept of like immersion and just understanding the people that you're with. So then when I was looking for volunteer corps, which I didn't even know existed until one of my other really good friends also did MVC. And she was like, look at this. Like, I think this is exactly what you're looking for when you're talking about you want a long-term volunteer opportunity. And I was like, oh, okay. And also, like Mary, I applied to a couple different ones, but the amount of intentionality that Mercy was able to give me, like I got a postcard, which are my favorite things in the world. They called me all the time, and it got to select to Marie, which is always great. And so it was just like very much like I already felt welcomed into a community before the community had even like fully been formed. So that was really cool just to be able to do that. And then I also got to hear about like the specific nursing placements and being able to be in a hospital in a position that's already like there. It's not like I'm in a specific volunteer position. I'm in just a regular nursing role, but I'm being volunteer. So that always brings up a lot of really cool conversations that I get with like my coworkers of like, you could be getting paid for this. And I was like, guys, all of my money would go to my loans or my housing or my transportation. And I get to take care of all of that, like through Mercy Volunteer Corps, and then just get to focus on me and let me grow in ways of being a nurse and being a human. And so that's kind of been like my favorite thing that I didn't know that I would know. But yeah, that's how I got here. And I'm glad I did.
Thanks. So thinking about how you got here, where you're going, how has your experience with MVC impacted what you're thinking about for your future, or even just what kind of skills or knowledge that you've gained, Mary? I know you talked a little bit about this too, but I would love to hear from all of you kind of what that has been like for you. What are you going to carry with you in your professional kind of experience? Claire?
Good question. I definitely think that this year of service will give me a broader perspective as eventually a future physician. Just having a greater understanding of the many challenges that our current healthcare system poses to so many people that don't have the resources to access adequate care. And I think just like the little things like considering that a patient might not be able to have transportation to go to an appointment, or maybe the doctor gives them a prescription, but the medication is going to cost them like thousands of dollars out of pocket, so that's not feasible. I think just like considering the many barriers and obstacles in place and being aware of that, and really trying to understand patients' perspectives rather than just like dismissing like, oh, maybe they're being difficult or like in a bad mood, but like understanding those challenges and really walking alongside them to help meet those challenges.
Yeah, absolutely. Emily?
So I knew in nursing school that I did not like labor and delivery. And so I just grouped mother baby into that. So like coming in and being like, you're going to do mother baby, I was like, oh, I got really nervous. But being able to see like how much like fun and joy and beauty is in it. I've always wanted to do peds. So I still get like I get to see kiddos all the time too, which is super great. But I think it's like more directly opened me up to like exploring different parts of nursing that I never would have expected to look at. I also agree with Claire. Like I look at a lot more of like, what is a patient scenario and what the doctor's ordering that I'm even confused by? How is that going to translate over to a patient? And how am I going to be able to be that, like, how am I going to translate it from medical terms into something that they're going to be able to understand? So I feel like I've been able to do a lot more of that here, and also just like find a whole area of nursing that I really love and I didn't know I would. So like what else is out there that I'm missing? So that's kind of fun.
I love that, Emily. Stepping out of your comfort zone. That's great.
So much.
Mary, how about you? Was there anything you wanted to add to what you talked about earlier in that relationship building and hospitality?
I think it was, well, first of all, it was good for me because the emergency department is kind of like a harsh place to be sometimes, you know? And I think as someone that kind of like feels a lot, it was like kind of stressful at first, but now it's like, it's hasn't like hardened up like how I see things, but I like feel like, you know, less susceptible to like being offended if like people, you know, act a certain way, you know? And I think that's a really good skill for me to have going into medical school, where like bottom of the totem pole, you know, good to be able to handle that. So that's good. And I don't know, kind of like, again, what Claire had said about like the barriers, like learning about the barriers that you're patients are facing. And some of them too that I like wouldn't even have thought of, like if a patient needs to have food with their medication, what if they don't have constant access to food every day, you know, like stuff like that, where it just has made me much more aware of things. And I think too, one thing was that I've realized how much I enjoy getting to have free time and hobbies, like when I come home from work. And this is probably one of the only times in my life that I will ever like not have like things to do after work. So it has been really nice to just get to grow in that area of my life too, and get to like kind of indulge myself in having hobbies, and realizing that that's something that I can hopefully try and continue on with in my life.
Yeah, that's great perspective too, and kind of leads us into the next question I was wanting to ask you all is about how you balance like the work that you're doing with all of the commitments to MVC, because you're not only volunteering and doing a full-time job, but you're also committed to your community, to growing spiritually, to simple living, to your own self-care. So how do those things kind of all work together and find a place in your experience? So I think Emily, you're up.
So my schedule is really nice in the fact that I work 3 days on, 4 days off, and those 3 days can be interspersed wherever. So like today I just got home from work, and then I don't work for 2 days. So I have 2 days off, and I had 3 days off before this. So I think just being able to, like on days that I work, I focus on sleeping and drinking water. And though that's my self-care for the day, and coming home and seeing my roommate or my community member and just being able to like talk to her quickly about what was going on with our day. And then we just go right to bed. I'm too tired to really get any sort of other self-care or other things like that in. But then I have 4 other days in the week where I'm really able to like invest in myself and invest in my community member, and just being able to like, also like Mary said, like I haven't had time to have hobbies. So now I've been like painting a lot more. I've been baking a lot more, lots of cakes and fun things. And it's been so nice to just like have those 4 days. And then to also like, sometimes I'm like, what am I going to do? And then I'm just able to fill it with things that I really love to do, and things that like Mercy has given us like outlets for, like the spirituality nights and the community things. And it's really fun.
Good. Mary?
Yeah, I think too, I definitely struggled with this at the beginning. I think partly too, I was studying to take the MCAT for the first 7 weeks I was here, and that was kind of stressful. And then I think after I was done with the MCAT and I had free time for the first time ever, I think the weight of like the work that I was doing kind of hit all at once, and it was very stressful. But then it was actually worked out really well because MVC does group processing sometimes. So it's like kind of like a mini group therapy session with the other volunteers, which was like super great because it's almost hard to talk about this stuff with other people sometimes, because like the dynamic of being a volunteer right now, especially during COVID, is so different from what anyone else has done. So that was super helpful. And I think too, like making a commitment to myself to continue my therapy throughout the year has been really nice, and to have like a professional outlet to get to talk to. And yeah, after I kind of like got through that hump of like compassion fatigue and kind of like giving myself some space, now I have learned more of how to leave work at work, and that I will not be able to give 100% at work if I take it home with me. So I need to like come home from work, shut the garage door, and it's over. Like it's done for the day. And then kind of, you know, get to hang out with my roommates and have dinner. And I also don't really think that the community, I mean, like it comes kind of easy, you know, like with community stuff, it doesn't really feel like a chore of we have to do this. So that helps.
Yeah, that's like the commitments that you're making in addition to your service are like where you can get self-care. Like a lot of times those things are intertwined, which I think is really cool. Claire, do you have some things to add?
Yeah, absolutely. I do think it can be challenging, absolutely, sometimes to balance everything, especially with like what Mary was saying, like compassion fatigue. Like, I think what we're doing this year is definitely difficult work, meaningful but difficult. But just like learning how to take time for yourself, which is not always easy. But I've really enjoyed having more free time than I've ever had in my life, like both of you guys said. So trying to pick up new hobbies, learning from my community members. One of them is a really good cook, and another one is a really good knitter. So I'm trying to learn some of their skills. And I think this year I've just really leaned on my community members to hold one another accountable, whether it be our spirituality nights or just like our own personal self-care, like knowing that we all cared about each other and want this year to be the most meaningful, positive experience possible. So just leaning on each other and finding a source of strength in our community.
Yeah, definitely. So the topic that I think we're all sick of talking about, as it's been around for almost a whole year, but is so important to what you guys are doing and you encounter in different ways. If you all could talk a little bit about COVID, are you seeing it with your patients? How have you encountered it? And really all you guys know is COVID from what the work that you're doing. So I would just love to hear a little bit about how you've seen or interacted with the pandemic or the results of the pandemic. Mary, if you want to start.
Yeah, so it's kind of nice because until we got the vaccine, we weren't required to see COVID patients. So if any patient had any sort of COVID symptom, my boss was like, you do not have to see them. You do not need to put yourself in that position without, we don't need to go into their room. We can call them after they leave the hospital. So that's been a really great opportunity. But I think it was kind of weird too because Savannah's COVID, bursts, I guess, were a little bit delayed, especially compared to Minnesota, where I'm from. Hearing about, ICUs were full all the time and all, it was insane and super bad. Whereas in Savannah, because it was still warmer, I think it was a lot slower and we're kind of getting to a peak now. And so now that we have a lot more COVID patients, it's definitely slowed down with how many patients we can see in the emergency department. But I think I've noticed more of the effect of how it has, the effect that it's had on our year, and just moving somewhere brand new during COVID is a very strange experience. And I think kind of learning to navigate through that in terms of you expect Mercy, you come and you get to hang out with the sisters, and that's kind of hard because you don't really get to see them right now. Or even just exploring your cities looks a lot different. But the nice thing is that my roommates and I have still been able to find some nice ways to be socially distanced or outdoors and still get to explore. So I think that's been definitely a learning curve too.
Yeah, thanks for that additional perspective on moving to a place that you could have had really high hopes for and what that might look like, and being changed, as for many of us it is, but to move to a new place is a challenge in of itself, and then to add the pandemic. Claire, how about you?
I think COVID is obviously intensely impacted the year, but I think in particular, just seeing how it's impacted our patients. A lot of them had insurance for a really long time, but lost it because they lost their job with COVID. There's some really big casinos here that laid off a ton of people. So these people are facing the challenges of uninsurance for the first time, just directly because of COVID. And then I think kind of what Mary said, it definitely is challenging to move somewhere new during a pandemic, which I think makes it all the more important to lean on community. And we've had some opportunities to connect as MVCs through Zoom, game nights and stuff like that, which is always really fun. And I think it's just made it more important to be creative. I think it's easy to use the pandemic as an excuse, oh, I can't do anything, I just have to stay here. But there's really so many things you can do that are outdoors, or just in creative ways to explore the city. So I think that's something that my community members and I have made a goal of really challenging ourselves to explore the city in safe ways during COVID.
Yeah, we have another game night coming up, volunteers. So be on the lookout for that. Those have been a fun way to connect across the country with other volunteers. So I'm glad you mentioned that. Emily?
So COVID greatly impacted like my entire path for MVC. So I was hopefully going to come into MVC with my nursing license already in hand, ready to go. But Maryland's Board of Nursing kind of just got really backed up with just trying to get applicants and everybody in. So I ended up not being able to take my license until like the end of October, almost November. So instead of like having me on the mother baby unit, they switched gears and then put me into the COVID swabbing unit. So I was able to swab lots of noses. I think I counted and it was about 2,000 noses in 2 months. Yeah, it was a lot of noses. But it was such a beautiful time to just be able to sit there and like take a step back in my plastic everything and to just realize like my first job as a nurse is working front lines in a pandemic. And how does that impact me? And how does that impact like the job I know I can do now, like as like I don't want to say a real nurse, but as like a licensed nurse. So like I was there when a lot of the patients had to hold their children in a really specific position so we could swab their babies. And how do I help this woman who has just started crying because her entire family tested positive and they have all these conditions? Or how do I celebrate with other people that their rapid test came back negative, and that's a one really good hope because they just saw someone and they don't want them to get sick. So it was constantly like a whirlwind of emotions and also trying to like take on and off plastic and everything, and just to keep track of who I like, what I've touched and all that. So it was a wild time for like August, September, October, November. And then to get moved up from like working in these conditions to get actually go on a unit was just like a total 180. My entire world just like started right on over again into nursing. But it's still really cool. I still see COVID a lot in the way that we have an entire like wing of the unit is just all plasticed off for COVID because we have a lot of moms that they're still going to give birth, but they have COVID or they just recently tested positive. Like the mom I had today tested positive at the end of December and it had just been 14 days. Or we even had a couple patients last week that they had been here for 5 or 6 days and then tested positive again. So it's been really interesting and really wild to like see all the work that goes into contact tracing in the hospital and see all the work that it takes for us to to keep us safe so we can keep others safe. So it's been like a whole whirlwind of COVID, but like I've really enjoyed this really new like learning experience. And also trying to get to know Baltimore in a pandemic is a weird time, but you know, it's been all sorts of fun.
Yeah, I appreciate all of you for how you've been resilient through this and in a time that you might not have predicted or thought of being as a volunteer, and just sticking with it and doing the best work that you can through it. So I appreciate you all for that. For those of you who are tuning in and watching us, please feel free to send us your chat us a question if you have one, or email them to us at contactus@mercyvolunteers.org. And if we don't answer them tonight, we're happy to set up another conversation to talk with you or connect you with one of these lovely volunteers. If you want to hear more about their placements, we're happy to do that as well. So a question that we have for you, since everyone tuning in here, or most people tuning in, are potential volunteers, what advice would you give to them? I see some thinking faces, so I'll give you a second to think about that. And while you think on that, I will tell everyone watching that our priority application deadline is coming up next Wednesday, January 20th. If you apply by that time, you get priority in service site placement, which is a mutual discernment process. But since we accept applications on a rolling basis, they fill as applications are coming in. So if you're listening to these lovely Mercy volunteers and you think, wow, that's a placement that I would really like, I would highly recommend applying by them. Emily is currently going Baltimore.
Yeah.
Yeah, so to apply, you can go to mercyvolunteers.org/apply to get all the information and start your application. So now that you've had some time to think about that one, Claire, do you want to start us off?
Sure. I think my advice to potential volunteers is really don't be afraid to go outside your comfort zone. I know when I committed to MVC, I was excited, but I was also kind of terrified because I was like, what am I getting myself into? And just know that, yes, it can be scary, but it's also such an exciting time. And you have a tremendous team of people around you who are going to support you. Um, and I feel like the best things in life happen when you go outside your comfort zone. So don't be afraid to just take that leap.
Absolutely, Claire. I agree. Emily?
I would say my number one recommendation is bring fun things that remind you of home and people that you love, especially because you guys will all be starting in a pandemic and hopefully everything will get sorted out. But the fact that you're applying in a pandemic is cool in general. But the one thing I'm really glad I did is I have like a whole wall of like cute notes and stuff that my family and friends have given me. And so then I'm able to like look at that every morning as I get up at 5 a.m. ready for work and just see like everything that it took for me to get here. It just definitely makes me appreciate it like so much more. Also make sure that you regularly are able to video chat your friends and family because it's so much fun to just share your experience with them as well as like all of the other volunteers, but it's so fun to be able to like bring it back home and be like, look what I'm learning. And my other one is to Google the city you're going to before you get there so you can find all sorts of fun things. And a lot of the times your friends and family will also be like, I've been to that city once and give you some weird off the wall thing they did. And those are really fun to do. So.
Yeah, thanks, Emily. I just wanted to add to that too, as you're even just thinking about volunteering, like really consider the people that you love in your life and what they see for you. Like they are part of your discernment process too, because they're going to be supporting you as you're a volunteer as well. Mary?
I would say probably the best thing I did was get my application in by the priority deadline, because then getting, in my opinion, I mean, you're working 40 hours a week at your service site. I almost think that's like the most important part when you're picking, because if you're spending 40 hours a week doing a job that you aren't excited about, that's going to suck. I never thought that I would be excited about living in the South, I'm going to be honest. And I like pretty much solely chose Savannah because of the position, but now I like love it here and I'm so grateful. And I think anywhere you go, I mean, MVC chooses cities that like are fun. They're not going to send you to like the armpit of America. So anywhere you go is going to be great. And your service site is going to be, in my opinion, like one of the most important parts of choosing your place. So get your application in by the priority deadline. That is really helpful. And this is just a small thing for if you come, but my grandma got me this little planner for the year that I like just write in what I did every day. And it's been really cool to be able to like look back and be like, oh yeah. And at the end of the year, I'll be able to look back and see like everything I did during each, how I made it through the pandemic. And I just think it's a really cool memento to have from the year. So that's definitely something that I would recommend other people doing too.
Yeah, I love that, Mary. I did the same thing as a volunteer. I made myself write at least one sentence every day. Yes. And when I'm talking to my community, we still go back and are like, wait, what happened? And like, what order? So I love that. Yes, definitely write down your thoughts and feelings and experiences. Yeah, great. So some of the other positions that we have, so we know we've got nurses, we have patient advocates, client navigators, as well as occupational therapists and physical therapists, and even healthcare administration. So there are a variety of kinds of healthcare placements depending on what you're interested in, what skills you already have or licenses you already have, or the ones you're planning to get in the future. So again, the priority application deadline is January 20th, and you can apply online at mercyvolunteers.org/application. We also have a social justice series that has been going on this year, and the next one is Earth. So the lovely Ann Curtis, who is a sister of Mercy, will be joining us to talk about some of the things that Mercy Ecology is up to care for creation. So if you're interested in joining us for that, that will be on January 26th at 7 p.m. Eastern Time. And you can find all the information for that and RSVP at mercyvolunteers.org. www.mercyvolunteers.org/community. So with that, I just want to thank our panelists and lovely volunteers for taking the time to be here tonight and answer some questions and share their stories. And if you need anything, feel free to reach out contact us at mercyvolunteers.org. Take care.